Okay, thanks for the opportunity, and I want to share you my experience using Sim&Size, and in this case, especially for the coiling with axiom coils. I'm not sure how well you all know about Sim&Size, but it's the simulation program, and it increases the safety, efficiency, and specificity for the endovascular procedures in neurovascular field. And I started with the FD-size flow diverters. Nowadays we have the simulation program even for stents, intrasaccular devices, and what I'm now going to show you for the coils. What you need at first is the 3D from the DSA. That's the thing that you need, and that's the thing that you do if you have an aneurysm treatment coming. You do the 3D, you import the data, and then you can do device-specific computation, and then you can do the very personalized treatment planning, and you can sort of jump into the process at any moment, like beginning from the first consultation if you have the 3D DSA already available, or you can do it at staff meeting or just before the treatment. And the newest thing with Sim&Size is the coil simulation. And I thought first actually that I don't need it, but I have found it very, very tempting, very increasing your learning curve, and especially for the younger colleagues. And you can simulate axiom framing coils and then all the soft coils as well. And with the simulation program, so you can evaluate the BR evolution and coil apposition, and what's important is that you can combine so that you can do even both of those two simulations at the same time, or combine so that you do the stenting simulation and coiling simulation for the same aneurysm treatment, or like with the flow diverter simulation and the coiling simulation as well. And then you can try like different strategies for one aneurysm treatment. Axiom coils, we have the framing coil, and then you can simulate the soft coils, the fill coils. With axiom coils, you have the detachment system that's very accurate, it works, but if it somehow wouldn't work, so you can always do the manual break so that you can detach the coil. And like here, you can see the softness of the coils, it's the lowest here, the soft coils compared to the other ones. So I'm not sure if everybody knows what VR stands for. It's the volume embolization ratio, and that's what we are talking about here. So first of all, coiling as itself, it depends where you are and how big the aneurysm, but it can be up to 30% of the coiling procedures that you get recurrence. But to get rid of that, so it's very important already from the first coil that you choose the right size and the right length to increase the volume. So the first coil VR should be already 30% of the whole volume, and that means that like the first coil you need to achieve the 10% at least of the volume, and then thereafter up to around 30% to get rid of the recurrences. So I have two patient cases here from my real life, and I have been coiling for years. I do other procedures as well, so actually I'm not that eager to coil nowadays because we have all the other stuff as well. But sometimes you just need to coil, like this ruptured aneurysm. So it's a PCAM location, left side, SAH patient. You can see the 3D there. And Yeah. Now, oh, should I go back? Like this. Yeah.
So actually you have an interactive poll if you want to help Dr. Rautio to treat her patient. So if you want to scan it with your phone, you will be able to answer the questions.
Okay, so then we will treat the patient. So you can see the measurements from the 2D images. And there are 4 options for the first coil here. Different diameters and different lengths. And now, according to the 2D measurements, I would like you to choose the framing coil without the help of the simulation. So which coil would you take? 5 by 8, 5 by 15, 6 by 25, or 7 by 20? Good. Good choice. Mm-hmm. Okay, good options. Yes. And then, if you remember what I told about volume embolization ratio, VR, what should it be? So if you look at the simulation image, so these are the same coils. So based on the 3D, so which coil would you choose? Now you have the simulation here. So which one do you use? The same coil as previously? Or so the same options now. Yes. So I didn't simulate. I used my own head. And I ended with the 5 by 15. And now when I see the simulation, so it shows that it's red. So I don't have good roller position. It's not big enough. And the VR, it's okay. But I don't show you the end result. But I had some neck remnant. And then I had some protrusion of the coils as well. So a larger and a longer framing coil would have made better result if I had done the simulation. But now then, so we have done the first coil, so what after that? We did the 3 by 25 in the simulation, and then we have added 2 more coils, soft coils. What would you do next? Is this fine? Is this okay? Are we fine with this? These are the options. You take 1 more soft coil to fill a 4 by 10, a 3 by 4, or nothing. What would you do? Look at the VR as well. Hint, wink, wink. Good. So this was enough. We have the 30% VR, and that's like the target, what we should reach. And the coil protrusion, there's no coil protrusion. It's green. That means that we have the nice wall position. It's not protruding too much. So it's less manipulation when we are not coiling with a too big coil either. And then I have another patient as well, got recently as well. So a ruptured one as the previous one. ACAM aneurysm, that's the 3D image. And I myself, I have not paid that much interest to the sizing of the coil actually. So I took a 8 by 29, and now afterwards simulation shows that it's far too small. It's red, so it's not opposing the vessel wall, so it's not filling enough. And as you can see, so the VR is 6.5, so it's far too low to be the first coil. We should reach at least 10% or even more with the first coil. So if I had taken a longer coil and a larger coil, it would have been better. As you can see here, the different simulations for the 8mm coil, for the 10mm, that shows green, so it's nicely opposed to the wall. And 12mm, it's too big, so there's more manipulation needed, more pushing needed if I take too long or too large coil. All the VRs are adequate except the first one. So in the real life, I used 13 coils to embolize this aneurysm. If I had used the simulation, so I would have managed with 9 coils without avoiding extra movements, extra maneuvers. So the target VR has been reached, and it shows green. That means that it's nicely opposed. So what we can reach with the coiling is to optimize the framing coil and then avoid extra manipulation, and all the patients are treated sort of the same way so that the level of treatment is the same. So I find this very, very promising and very helpful. And for those who have not been using Sim&Size, so there's a short video here showing how you manage that. Yes, 3 minutes and 40 seconds. I'm not sure if I could be this fast, but it's actually, once you notice how it goes forward, so you really can do it. And with the new improvements, so the thresholds and all that, so they are sort of already, so it really minimizes your time. So this is not much of the treatment itself. It's not very time consuming when you are treating an aneurysm. Yeah, thank you. Thank you very much.